Bunions. Maybe you have it or you know someone who has it. They're very uncomfortable, quite painful in shoes, and you probably don't know what to do with it. That's the topic of today's video. We're gonna break it down. I'm Dr. Khosroabadi. I'm a board-certified foot and ankle surgeon. Here on this channel, I'll educate you on foot and ankle conditions and treatments. So there's 3 types of bunions you may have: mild, moderate, and severe. What causes bunions? Bunions are formed when you have abnormal pressure forcing the first metatarsal, this bone, to go outwards. As a result of that, the joint becomes jackknifed and forms a bunion. You may ask, where is that abnormal force coming from? In my opinion, 99% of bunions are genetics. That means in your genes, either your parents or grandparents, they had bunions and now you have the genes. Number 2, tight shoes. If you're constantly putting your feet inside a tight pointy shoes, also wearing a high heels, you will start forming a bunion. And then foot structure. Your foot structure can be prone to forming bunions. That means you're overpronating. By overpronating, you're pushing the first metatarsal out constantly, and that could form a bunion. Signs and symptoms of a bunion. Basically, how would you know if you have a bunion? Number 1, pain, tenderness, and redness right around this bump. All right. And then number 2, you may develop a callus or hard skin in this area. That can show you have a bunion. And then also difficulty walking or wearing closed-toe shoes. Okay. And another thing is when you start noticing that your big toe starting to deviate towards the other ones, you know you have a bunion. All right. Now that you know you have a bunion, what are you going to do about it? Let's talk about your shoes. If you're wearing tight, narrow shoes, you got to get rid of those. Those only going to make the problem worse and give you a lot of pain. Choose wider shoes and shoes that have a bigger toe box to accommodate your foot comfortably. There are different types of padding you can buy from the pharmacy, which can cushion the area and maybe give you some comfort. Applying ice. When you get home, you may want to apply ice to the area. That would reduce the inflammation and cut down on your pain. If none of these options are helpful, you need to contact a podiatrist. A podiatrist can make you a custom-made orthotics which will prevent you from overpronating and pushing the toe joint out. You can also try physical therapy, which can bring the joint back and stretch these muscles that are really tight on the inside of the foot. And if none of that helps, he will offer you a surgical option. And in most cases, the podiatrist will offer you a surgical correction. A question I get asked all the time: can I prevent having a bunion? No, you can't. In my opinion, bunions are not preventable. However, by choosing the right shoes and doing the right exercises, you can slow down the progression of the bunion. So let's say you have tried all conservative treatments and you still have pain. What do you do next? I recommend surgical procedures to remove the bunion. You may ask, what procedure am I candidate for? So generally, there's 2 types of bunion procedures: head procedures, where the entire surgery is happening in this area, or base procedures. The entire surgery will be happening in this area. Normally, base procedures are very unstable. Therefore, you're going to be in a cast for 2 weeks. You'll be in a boot for 2 weeks, and into a surgical shoe for 2 weeks, and then into a normal shoe. The head procedures are less painful and you're more mobile. Most of my patients are walking the next day. The bone still takes about 8 to 10 weeks to heal, but head procedures are more preferable by patients and doctors because the recovery is a lot shorter, less pain, less swelling. The most invasive and unstable procedure is called lapidus or 𝘵𝗶𝘀𝗃. It involves taking the joint right out of the base of your toe and fusing it with plates and screws. This is very unstable, therefore the patient has to be put in a cast and they're not able to walk at least the first 2 to 4 weeks. Now let's talk about traditional bunion surgery. Traditional bunion surgery is mostly done at this level, the neck-head junction. This is more stable than lapidus procedure. However, traditional bunion surgery is an open procedure which is also invasive. So in this case, you will be in a shoe for at least 4 to 6 weeks and then starting to wear normal shoes. The scarring is bigger, about 3 to 4 centimeters, and you may need physical therapy to get your range of motion back. Now let's talk about a minimally invasive bunion surgery. This is something I have dedicated my entire career to for the past 11 years. So minimally invasive bunion surgery is very similar to traditional bunion surgery, except you have smaller incision and the surgeon operates through these small incision to perform the bone cut and shifting the bone to the corrected position. Most of my patients walk the next day. They will be wearing a surgical shoe, but they're completely walking full weight bearing the next day. Pain and swelling is 50 to 60% less than a traditional bunion surgery, and most often these patients do not require physical therapy. So in conclusion, bunions are hereditary. You can deal with the pain, and when it becomes unbearable, you probably have to end up having a surgical correction. Thanks for watching. Don't forget to subscribe and hit that notification bell. Give this video a like. Your support means a lot to us and helps us grow our channel. Until next time, stay awesome, and I'll see you on the next video.